Amelia Kirby, welcome. You have been honored with the Student Nurse Environmental Health Leadership Award thanks to your remarkable work with the Planetary Health Report Card for nursing. Can you tell us more about that project?
Sure. Well, first of all, thank you so much. I'm very excited to talk about it because it's a wonderful student and nursing-led initiative that serves as a metric and a needs-based tool to help nursing students evaluate their nursing programs as to how geared towards planetary health, how sustainable, and how much planetary health and climate health curriculum are involved in their programs. And so the Planetary Health Report Card originally came from medical schools starting in 2019. And after being introduced to it at a conference, myself and a group of other student nurses realized, this is something that nursing schools really need as well, and serves as a great place to start for nursing students who want to get involved in planetary health. So we, over the last few months, we worked to create, over the last year, really, we've worked to create this report card that is nursing-centric, student-centric, and best includes all the different types of degrees and programs that fall under the umbrella of nursing, so students can best use it to figure out where they need to go and how their programs can grow going forward after being assessed.
Thank you. How cool. Thank you for your work, which certainly aligns with the theme of this summit held by Alliance of Nurses for Healthy Environments, redesigning health for people and the planet. So what is your vision of how the Planetary Health Report Card for nursing will change student nurses' understanding of engagement and action around planetary health?
Right. So as student nurses, all of us learn one of the most fundamental things about nursing skill and then nursing critical thinking is that starting with an assessment. So, as I move through my program and my schooling, I noticed there's so many interested people and so many motivated people in nursing, but without a way to figure out where you stand as a program and the places that you need to go, I found, and like I said, my peers and I found that you have to start somewhere, and using a tool and having something very physical to fill out. And a big part of the report card that's very helpful for students to feel empowered is that a big part of it is contacting your administrators, contacting your faculty, and creating those connections and letting your voice be heard, which I think is a huge, huge part of being an advocate for climate and just being a nurse in general and advocating for yourself as a nurse and a nursing student. So with that in mind, using the card as a way to get engaged and as a way to create these connections and really make a name for yourself as a climate advocate is the best way that the card can be used, and the best way that you can really set these goals for yourself, for your faculty, and for your administrators in your program.
Advocate. Thank you.
Yeah.
So what is one ask you have for attendees of this conference to help build a better planet for us all?
I would say the biggest thing that this process has taught me and the report card has taught me is that you start somewhere, even if it's something small, and it feels like it's not this big, splashy initiative or anything like that. It's starting anywhere, because everywhere you look in healthcare, you will find like-minded people who are motivated to help you and help you change things and are there to support you. So starting somewhere, even if it's sending emails, starting somewhere, even if it's doing research or reaching out to legislators or faculty, any kind of stakeholder to figure out what needs to happen in your program, or in your hospital system even as well. That's the best thing that you can do, because the second you start pushing in that direction, there are people there who you'll immediately find yourself surrounded by people who are like-minded and care. And that's how change really seems to be happening, is just the second you start nudging, you can build critical mass pretty quickly. And I think that's like at the core of nursing and nurses' involvement in climate health. So that's all start somewhere.
Start somewhere. Thank you, Amelia. Well, you are an inspiration to us all. Congratulations again. We're so happy to have you as part of the profession. We appreciate you.
Thank you so much. Thank you, all of you.